Hello everyone. In tonight's audience we have my two dogs. You can see my lab is kind of blended into the blanket there. Many of you may have overheard rumblings about the opioid epidemic. According to the CDC, 70,000 drug overdose deaths occurred in 2017 in the US, and approximately 70% of those deaths involved opioid use. While this number may seem relatively low, considering the full population of the US, I think it's important to consider how this number may grow over the years. The US Department of Health and Human Services describes the opioid epidemic as the widespread misuse of both prescription and non-prescription opioids before it became clear how addictive these medications could be. You may be asking yourself, how did this occur? Well, in the late 1990s, pharmaceutical companies assured the medical community that patients would not become addicted to opioid pain relievers. Well, this led providers to prescribe them at a much higher rate. It turns out these companies were dead wrong. People began abusing their opioid prescriptions, while others began manufacturing their own. To help illustrate the opioid epidemic over the years, I prepared a couple of visual aids which I pulled from the CDC website. The first of which illustrates opioid-related deaths from 1999 to 2017 in a series of waves. The first of which is 1990s, which marks a rise in opioid prescription overdoses. As I discussed earlier, doctors were unaware of the addictive effect of opioid painkillers, so they began prescribing them more often. In Wave 2, or 2010, there was a rise in heroin overdoses. Heroin is an illegal opioid which can be manufactured from morphine. In Wave 3, or 2013, we have a rise in synthetic opioid overdoses. Synthetic opioids, such as fentanyl, are very powerful and can be illegally manufactured. This brings me to my next visual aid. In this graph, we have the number of reported law enforcement encounters testing positive for fentanyl in the US. You can see up until 2013, the number remains relatively consistent. However, jumping from 2014 to 2015, the number of cases skyrockets. According to the CDC, the increase in fentanyl-related overdoses does not involve the prescription fentanyl, but is related to illegally made fentanyl that is being mixed with or sold as heroin, with or without the user's knowledge. As you might imagine, fentanyl-laced heroin could have devastating impacts to unaware users since their normal dose with regular heroin is much less powerful. In closing, the opioid epidemic began in the 1990s when doctors began prescribing opioid-related painkillers at a much higher rate. As a result, patients became highly addicted to these drugs and began abusing them. As the demand for opioids grew, people started illegally manufacturing heroin for both sale and use. Next, dealers began mixing heroin with a more powerful opioid known as fentanyl, which is deadly in high doses. The opioid epidemic is only becoming worse, and I think it's our responsibility to spread awareness about the dangers of opioid addiction and abuse. Because once you start, you are hooked. Alright guys, thank you. Thank you for listening, and I hope you have a great day.